This was her bib. This is actually the last thing she wore. So
for Columbus, Ohio native Shanae Scott, delivering Jaya Christina was one of the happiest days of her life. She says it was awesome when she learned she was pregnant.
Definitely when I heard the very first cry, that's when my tears came. Like I just cried and started asking a million and one questions. Can I see her? Can I hold her? Is she okay? She was perfect. She was perfect. I was healthy, the surgery went fine, and she was healthy, so.
Shanae loved being a new mom. She read all the materials and information she received from her doctors and family to help keep her baby safe and protected.
But as a mom, you want to have the feeling of you can protect your child, you're okay, you got this. So in my mind, I'm okay, I got this, everything's gonna be fine. And during your pregnancies, you hear all the, what could happen, what can happen, accidents, just things you should look out for. And you don't really think it could happen, it could happen to you. One night, it happened to me.
One evening, after feeding Jaya, changing her diaper, and putting her to bed, Shanae checked on her baby. Little Jaya did not respond.
That's all I remember. I hear the machines, and I just, all my attention is on her. I'm just watching her, just hoping her arm, she moves, she cries, something, just nothing happened. I hear the doctor say they pronounced it basically, and it was just like, it was hard. Just every day, I wasn't sleeping really. Thank God during the whole, 5 weeks that she was here, I took a lot of pictures. Of course, as a first-time mom, you're gonna do that, take a lot of pictures. So we had a memory for each picture.
For Lori Mosley, mother of 3 and grandmom to now 8, the issue of infant mortality in our community hits home hard. She lost her infant child years ago and recently lost a granddaughter, both before each reached their first birthdays. She shares her story to help educate others about the importance of safe sleep practices.
When she was born, she came out ready for the world. She came out smiling. She was happy. She was a beautiful baby. My daughter called me on the phone and she said, "Mom, Dallas isn't breathing." And immediately I started hyperventilating. I couldn't breathe because I said, "Lord, this can't be happening." It was like a dream. Like, I can't believe that this is happening again.
Baby Dallas died in July 2015.
So when when Sharon passed away, there wasn't a lot of resources out here. Because I didn't want my child to feel the same hurt that I went through 22 years ago. I wanted to cry. I got angry with life. Like, why something that precious, that gentle, something that never done no wrong? How can a life like that be taken in a matter of seconds?
Lori says the focus on addressing infant mortality in our community is critical to reducing infant deaths. She acknowledges that organizations play important roles in helping families through such tragedy. Lori praises the Neighborhood House as helping her identify support and resources for her family during the family's time of need. Today, Lori and her daughter Roshana take it one day at a time.
We try to just take it day by day. I have other children that I have to think about, and I can't stop, doing stuff with them or our life just because of that, I mean, she's not gonna never go nowhere. She's still gonna be with us, but I still gotta make sure they're okay being their mother too.
There's a lot of things that have to do with SIDS that if people were educated about those situations, that maybe it would cut down some of the deaths in our community.
As parents, grandparents, friends, and family members, we can all play a role in helping our babies reach their first birthdays. Lori, Roshana, Shanae, and others are courageously sharing their stories to help spread the news about safe sleep practices, having babies sleep alone, on their backs, and in empty cribs. To learn how you can help more babies celebrate their first birthdays, visit CelebrateOne at celebrateone.info.
Wow. This is clearly why we're here today, to keep more babies from dying and to prevent more of the heartbreak that we witness in this video. We applaud the courage and conviction of the mothers in the video, Lori, Roshana, Shanae, for their willingness to share their stories and educate others about this crisis. No, I'm going to call it something else. It's a quiet epidemic, and we're trying to shine a light on it, so we can't be quiet about this any longer. Good morning. I'm Donna James, co-chair of the CelebrateOne Executive Committee. I, along with my co-chair, our co-chair, Mike Fiorelli, and the entire executive committee, we're very pleased that you've taken this time to join us today and many others in this room. As many of you know, we began our work about 2 years ago, charged by our then City Council President and now Mayor Andrew Ginther, to develop a strategy and approach that addresses infant mortality in our community. The Greater Columbus Infant Mortality Task Force was formed. We spent several months identifying issues related to infant mortality, understanding the key drivers, and learning what other cities across the country have done to successfully reduce the number of babies dying before their first birthdays. We charted a path that was tailored to our city, and in particular to our areas in our city, our neighborhoods that are the most vulnerable. The task force identified 8 recommendations to help us address this issue. Once we completed that work, CelebrateOne was launched as a collaborative to implement those recommendations. Leanne Eagle was hired as our executive director. I like that Eagle last name because she has helped us to soar to new heights. Our ambitious goal is reducing infant mortality by 40% and cutting the racial disparity gap in half by 2020. And for me, that's a bottom line goal. It's not the end game for us. Today, we are pleased to outline some of the progress we've made to date. We're proud of our progress and recognize this is clearly a marathon and not a race. It will take time for us to begin to see significant reduction in infant mortality. But here's what we know. Our collective and steady focus on the strategies that help change community conditions, practices, and behaviors will get us to our end goal of having Columbus and Franklin County families celebrate more first birthdays. And now I'd like to turn it over to the man who had the vision and the commitment to galvanize this community to address this quiet epidemic and helping us shine a clear and laser-like focus on it, our Mayor, Andrew Ginther.
Good morning, and thank you, Donna. I am very pleased to see our partners, our community, and each one of you here with us today. Our City Council continues to be a very strong advocate of this work and great partner in this effort. And I want to recognize the Finance Chair and the President Pro Tem of Columbus City Council, who has been instrumental in where we are today. And that's Councilmember Priscilla Tyson. Would you stand and be recognized? Thank you. As Donna mentioned, 2 years ago, we pledged to address the issue of infant mortality head-on in our community. Since then, we have come together as a collective to identify where the issues are, educate the community about the seriousness of the issue, outline who and what entities can address specific areas of concern, enlist and train community advocates and partners, and develop short and long-term solutions to help us reach our goals. We are very fortunate to have with us today one of our most fierce advocates and one person who has been a dynamic leader on this issue throughout our entire state, but has been with us every step of the way. And would you please join me in recognizing our First Lady, Karen Kasich, for all of her work and everything she's done. And I know Director Hodges from the Ohio Department of Health is here as well, who's been a great leader on this issue, and appreciate you and the governor's commitment and the other elements of state government that are helping us work on this. I know you've got the entire state to worry about, but this is the most important place in the state. Obviously, the Franklin County Board of Commissioners, President Grady is here, and all of the great county offices that we've worked with, the Ohio State University, and Ohio State Medical Center, churches, faith-based organizations, our nonprofits, our amazing superintendent, Dr. Dan Good of Columbus City Schools, and all of the community members. I can go on, but here's my point. We've all come together and focused our work to help improve the lives of our youngest citizens, to save our babies. That is a win for families and babies in our community, and it's a win for our city. Leanne will outline all of our partners a little later, but I just want you to know that I am eternally grateful for your commitment in doing what it takes, because everybody has a role to play to make sure that children in our community get to their first birthday and thrive in those earliest years of life. And I want to thank you for your leadership. As Donna mentioned, we know the most significant factors that contribute to Columbus's high infant mortality rate are babies born too small or too soon, sleep-related deaths, exposure to tobacco smoke during pregnancy, and secondhand smoke in their earliest days of life. Health inequities, the social and economic conditions that cause black babies to die at a rate of 2.5 times higher than that for white babies. The 8 recommendations of the Greater Columbus Infant Mortality Task Force and the progress we made are centered on addressing these core issues. Through this process, we have learned that where we live, learn, work, and play has an impact on our health and the health of babies in our community. There are neighborhoods in Columbus where so many factors contribute to babies being born too small or too soon and not thriving during their first year of life. You've heard me say it before, but I need to say it again. A zip code in a neighborhood should never determine an individual's health or the health of a baby. And in Columbus, with your help, we are working to make sure it doesn't. I'm proud to share that over the course of the last year, we have put boots on the ground in some of our high priority neighborhoods, and we are making progress. You will hear more details about our community work from one of our great faith-based partners, one of the first people to answer the call and to step up and lead the way and galvanize the faith community. You'll be hearing from Tridestone's First Lady, the amazing Patricia Ross, in just a few minutes. And CelebrateOne's Director of Community Strategies, Erica Clark-Jones. I'm pleased with what we've accomplished and where we are headed. Also today, you will hear more from our partners on additional progress we have made to date. And of course, our report provides details on the progress made on each one of the 8 recommendations of the task force. One of the critically important parts of our work that we talked about as we went through the process is setting what is widely recognized as the most ambitious goal in the country, but to hold ourselves accountable by reporting out to the community every year on the progress that we're making. We know this is not going to be done overnight, but we must move with a passion and an intensity and a sense of urgency, because our smallest lives are on the line. Thank you for all of your unwavering commitment. Our collaboration gets us closer to reaching our goal of reducing the infant mortality rate in Columbus and Franklin County by nearly 40% and cut that racial disparity gap in half by 2020. And as Donna said, that's not the end game, but that's where we must focus, and that's where we start. to make sure that our children and our grandchildren enjoy the remarkable quality of life that so many of us enjoy in this community today. It's now a great honor to welcome Leanne Eagle, Executive Director of CelebrateOne, who will talk with us a little more about our work in this first year. Please welcome Leanne.
Thank you, Mayor Ginther. It's just so wonderful to have you at the helm. Your leadership and your dedication to this issue is unwavering, and that really helps all of us doing the work every single day. As many of you know, it's been a little bit over a year since I came on board, and boy, what a year it has been. I am continually awed by the commitment, the energy, and the engagement of organizations and individuals who are working every single day to lift up the babies in this community. Well, I have the privilege of overseeing the implementation of the Greater Columbus Infant Mortality Task Force Plan. The credit for our progress goes to our lead entity organizations. Those are the systems, agencies, and individuals who have taken responsibility for the strategies. And now I want to recognize each of them. So I'm going to call your organization's name. I want you to stand and remain standing so people can see all the wonderful work that you're doing. First up, the Central Ohio Hospital Council. There's Jeff. Columbus Department of Development. I know I saw a couple people from development here. Rita's here somewhere. There we go. Okay. Columbus Public Health. Franklin County Department of Job and Family Services. Franklin County Family and Children First Council. Ohio Better Birth Outcomes Collaborative, also known as OBO, and that's made up of our 4 hospital systems: Ohio State University Wexner Medical Center, Mount Carmel Health System, Nationwide Children's Hospital, and Ohio Health. Also Primary One Health and Columbus Public Health make up OBO. The Ohio Department of Medicaid and Partners for Kids. Please join me in congratulating the people on their progress and thanking them. I know Donna mentioned the group of individuals who serve as the executive committee. I won't make you stand, but I am going to say your names because you're wonderful in your support and your dedication to this effort. Our executive committee for CelebrateOne is Dr. Steve Allen, Dr. Charles Booth, Michael Fiorelli, Nathan Hurd, Donna James, Eric Janis, Dr. Teresa Long, and Steve Shoney. So let's thank them for their dedication and support. I also want to give a personal shout out to 2 individuals who have been great support to me during this first year. As you may recall, during the task force process, that we had 2 wonderful facilitators, Jesse Cannon and Julie Robbins, who are here today. They have been, through the past year, part cheerleader, part mentor to me, and also just a phone call away. So they've provided tremendous guidance, and look what your work has spawned. Thank you to you both. Our work for CelebrateOne would not be possible without the significant financial contributions of our partners, most notably the City of Columbus, the Franklin County Board of Commissioners, and our 4 local hospital systems. We're also fortunate to have received a sizable grant award from United Health Foundation for our work in the community. And I want to recognize Tracy Davidson, who's here from United Healthcare. Thank you for your support of our work. And as Erica, I'm sure we'll talk about, we are so excited to have our community connectors here. It's really a demonstration of what your award is doing for us and what we were able to do going forward. If any of you read today's dispatch, I have often referred to the work that we've done in this first year as setting the table. Our work has been foundational. We're putting new strategies, policies, and practices in place that we're confident will improve the lives of families and babies in our community over time. I think when I think about we face many challenges in this work, but I think one of the greatest challenges that we face is patience. We want this problem to be solved now, but we know it's going to take some time. And while our heads know that it's going to take some time, our hearts, those of us that are working in this space, our hearts are absolutely crushed when we hear that a baby has died in this community. But when we do, we really kind of strengthen our commitment. We are unbowed. And as much as I say we're setting the table, we're digging in at the very same time. We are working really hard. The people in this room are all really working hard to make sure that we're putting the right strategies in place, monitoring our efforts, tweaking them as we need to, and doing all we can in support of families and babies in this community. Today, while we're not able to walk you through every single recommendation, because if we did, we'd be here well into the evening, we do want to spend the next few minutes highlighting some of our more outward-facing efforts. I ask, however, that you do take some time. We have a wonderful report that outlines these efforts, so please take some time and review it so that you can see what we're doing, all that we're doing that's really critical to our progress. And I do want to mention that people are taking notice. I think probably not a week goes by that Erica and I don't get a phone call from someone around the country asking us about what we're doing. People are hearing about it. I just spoke with someone from New Orleans who said when she was really researching what's going on in this country, a community in California came up, Baltimore with their Be More for Healthy Babies, and CelebrateOne. So the word is getting out. And even last night we were recognized. Eric and I had the privilege of attending Congresswoman Beatty's State of the District speech, where CelebrateOne was recognized for outstanding service to the community and to the nation. We received a beautiful proclamation, and that proclamation goes to you all that are doing the work. But we were honored to actually be recognized for our work. With that, I want to turn it over to my colleague, Erica Clark-Jones. As the mayor said, she's outstanding in the work she's doing in this community, and I couldn't think of a better partner to work with every day on this issue. Erica?
Good morning. Thank you, Leanne, for that kind introduction. Thank you, Mayor, for your courage. Thank you, Donna, for your leadership and that of the Executive Committee. And thank all of you for being here today. Over the past year, I've had the opportunity to connect with stakeholders from all 8 of our Columbus neighborhoods that are most impacted by infant mortality. These neighborhoods are challenged with higher rates of infant deaths, and the barriers associated with high rates of poverty, unemployment, housing instability, limited food access, safety concerns, and transportation. From our work in these neighborhoods and the countless community conversations with residents and stakeholders, particularly in the Phase 1 communities of Linden, Near East, and what we call the Near South, 2 critical aspects of our work cannot be underestimated, and that is the power of place and the power of partnership. In our first year on the ground, we have worked with a diverse group of partners from for-profit, nonprofit, and civic organizations to every department within city government. These partners have come together in our high-priority neighborhoods to lay the groundwork for upstream solutions to this complicated problem. Nowhere is the importance of partnership in place more evident than with the work in our faith communities. As trusted voices focused on equity and rich with heritage and tradition in our community, faith leaders are key partners in our work to reduce infant mortality. That's why I am so happy to be joined today by Tridestone Missionary Baptist Church First Lady Patricia Ross, who will share with us more why having the faith community is so important to this work and what her congregation is doing.
Thank you. First of all, I'd like to take this opportunity to thank First Lady Karen Kasich and Dr. Teresa Long, who initially invited us to be a part of this collaborative, and the staff of CelebrateOne and all those partners who are working to make this such a wonderful, wonderful event. And outcome is going to be fabulous. I promise you, it's going to be fabulous. Thank you for the impactful work that they have done, and thank them for what they are doing to address this issue and this immense challenge of reducing infant mortality. I'd like to also, and I was going to do that, congratulate Erica and Leanne on the honor that they received last night for their work with CelebrateOne. It was a wonderful event, and we were glad to be able to witness that as well. As part of the based community here in our city, it is our esteemed pleasure and privilege to partner with CelebrateOne in this initiative. Having been in the community for over 50 years, I know I don't look over 50, right? 33 of which I spent as an employee of Franklin County Job and Family Services and as a mother who birthed 2 premature children, which at that time, 1967 and 68, there was nothing in place to address the fact that I had 2 at-risk children for infant mortality. I understand the plight, and I know that where we live, learn, work, and play has an impact on our health and the health of our community. In May of 2015, I, along with other women of the faith leaders, were invited and attended a meeting at the governor's residence. Following that meeting, we were commissioned to share, reach out, select, and bring together 5 women in our local assemblies that could assist in moving forward with this initiative. In July 2015, myself and 5 women from our assembly, Tridestone Baptist Church, attended the summit held at the Columbus Foundation here. 4 of those women are present today. Raise your hands, because I want them to know that you're still working. We also attended several of the forums that were held in our neighborhood community centers. In October of 2015, Erica Jones and the staff of CelebrateOne were invited to present information about the CelebrateOne initiative to the women of Tridestone. After that presentation, we decided that we wanted to do more. As a result of my request for young persons to become involved, Tiara Ross, raise your hand, Tiara, who is also my granddaughter, who also is an attorney, I'm very proud. One of the 5 women, a Tridestone member, and a Columbus Urban League Young Professional Development Chair, partnered with a community service chair, Brianna Linham, to spearhead a baby products drive for CelebrateOne. Dr. and attorney Tiara Ross is here today. Baby shower dates of November 2015, November 10th and December 10th, 2015, and there were products that were collected, that were donated and collected for those baby showers. Those products were soap and hand sanitizer, baby socks, diapers, wipes, shirts for moms, Gerber snacks, laundry detergent, crocheted baby hats, bus passes, onesies, baby food, and the recipient organization was Moms to Be. In February 2016, you can clap for that, yes. In February 2016, representatives from the Columbus Health Department conducted Safe Sleep Ambassador training on site at the Tridestone Church with over 60 women attending and becoming certified to share the ABCs of safe sleep with others. I don't have any specific statistical information that I can share with you relative to our targeted audience, the audience that we've been able to reach. But we all know that knowledge is power, right? And I can tell you that the mere dissemination and sharing of information, along with the education of this concern, has had a significant impact in our church and in our community. What we do is we continue to disseminate information, we continue to share information, and we are in conversation with Erica and CelebrateOne about next steps that the Tridestone Church can take as we continue to be a part of this collaborative. Thank you for listening, and thank you for the opportunity.
Thank you, First Lady Ross. You can see why our partnership is so valuable. Faith outreach is just one example of how partnership and place are critical in our neighborhood work, and we especially want to thank the Central Benefits Health Foundation for their $168,000 grant that allows us to develop robust, faith-based, and affinity group engagement efforts that will span across all 8 of our neighborhoods. And at this time, I would like to recognize Ms. Dee Malone, who will join our team on Monday and lead this effort. Additionally, this year, with the support of $1.7 million grant from United Health Foundation, thank you, Tracy, we launched the CelebrateOne Community Connector Corps. This program will train 72 residents as community health workers over the next 3 years to serve in our neighborhoods by connecting women of childbearing age to health resources and families to needed social supports. These connectors will also document the barriers to care that residents are experiencing to provide our policymakers with a platform to make system improvements. The Connector Corps is a partnership of residents, elected leadership, city government, higher education, workforce development, United Health Foundation, and several local community-based agencies, including the Neighborhood House, Community Development for All People, J. Jireh Ministries, St. Stephen's Community House, PACT, the YMCA, the Far East Pride Center, Moms to Be, Gladden Community House. And let me tell you, if there are other organizations in the room, I'm coming for you too. You will host connectors by the end of this 3 years. In just 4 weeks, our first class of connectors will complete their requirements for their community health worker certification. I am pleased to be joined today by members of our first cohort of connectors. I would like to thank you all for being here. Thank you for your passion and dedication to the work. Stand and be recognized, please. It is a privilege to be a part of this significant effort. I continue to be inspired by the willingness of our partners, large and small, to collaborate to save babies. Our partnerships have even extended beyond Columbus, as you heard from Leanne, and we share and learn with other cities and agencies, all working to find a way to save more of our youngest lives. By coming together in partnership to change the quality of life for families, we can succeed. Because as our mayor says, this is Columbus, and this is what we do. I love that, by the way. I'm using that everywhere. So now, there is a saying that many hands make light work. Thank goodness the Franklin County Commissioner's Office is not scared of the hard stuff. I am honored today to introduce my friend, President of the Franklin County Board of Commissioners, John O'Grady.
Well, good morning to everybody, and thank you for having me here to share some updates on this important work. I am and have been extremely proud to be a part of the Infant Mortality Task Force that Mayor Ginther convened and called me and asked if I would serve. I am proud to be a part of the unprecedented community-wide effort under CelebrateOne to carry out these recommendations. There's nothing more important in our lives than family, or more important to a community than strong families. That's why the county has and will continue to work with CelebrateOne and all of the partners here today to prevent the terrible losses behind the infant mortality statistics that we discussed. As part of this annual report, I've been asked to share updates on Franklin County's progress with improving access to health care for women before, during, and after pregnancy. This strategy was born out of studies showing access to primary health care is essential to improving women's health before pregnancy, and the availability of health insurance, whether public or private, is critical for women to receive care on a consistent basis. To that end, the Franklin County Department of Job and Family Services has made significant technical and process improvements to ensure qualifying women of childbearing age can access health coverage under Medicaid. I'll give a few examples. The department convened local hospitals, community partners, and health centers to collaborate and provide training on enrolling women in Medicaid using a process known as presumptive eligibility. Presumptive eligibility is a process by which qualified and trained entities may presume an individual eligible for Medicaid based on certain criteria and provide immediate health services while he or she awaits final approval on pending Medicaid applications. We've also found having JFS case managers on site in area hospitals such as Nationwide Children's Hospital and OSU Wexner Medical Center is a great way to provide real-time application assistance. So we've expanded our footprint and added case managers at Mount Carmel East, Mount Carmel West, St. Anne's, and Columbus Public Health. JFS has also developed new partnerships with the Franklin County Sheriff's Office to ensure pregnant inmates have access to care. In fact, they've prioritized all applications where a person indicates pregnancy. Any application indicating pregnancy is now processed by a specialized unit within 24 to 48 hours of receipt. If we're unable to immediately approve full Medicaid, then we grant presumptive eligibility. These results are encouraging since we began this work in February of 2015. We have seen a 56% increase in enrollment among pregnant women and a 21% increase in overall enrollment among women of childbearing age. In the high priority neighborhoods, enrollment rates for pregnant women have seen a net increase of 51%. While total enrollment for the target population of women has increased by 19% over the same span. And in 2016 alone, more than 1,000 women have gained access to Medicaid. While this is fantastic progress, but certainly we have a long way to go. Our next steps are to continue to work and develop a communication plan across the healthcare system to help people understand how to access healthcare, why it's important, and how to use it for preventative or other needs. As we reflect on our progress and move forward in 2016, I'd like to say that I'm very proud of the JFS department and its leadership. Mike McCammon, our JFS Assistant Director, Robin Harris, the Deputy Director of Policy. I just gave Robin a raise and a promotion. Eric Janis, our Deputy County Administrator. My Budget Director is going to be mad about that. And Joy Bivens. Many of you may have heard that Joy has been appointed our new JFS Director just last week. My colleagues, Marilyn Brown, Paula Brooks, and I have the full faith and confidence in her and her abilities and her leadership of this team, their work, and all of their work within the community. Thank you to everyone for the work that you're all doing. And we are excited to see that every Central Ohio baby gets to celebrate their first birthday. Thank you.
Good morning. I'm Dr. Phil Schubert, the Director of Maternal Fetal Medicine at Mount Carmel Health System. And before I go into my talk, I want to acknowledge my former chairman, residency director, fellowship director, Dr. Steve Gabby, in the front row here, retired CEO for University Hospitals at Ohio State. That is actually somewhat self-serving because I'm having flashbacks of presenting a morning report now. So if I phase out here, you'll have to forgive me. But I'm here actually on behalf of the Ohio Better Birth Outcomes collaboration, which actually is it's a unique collaboration that joins all of the community hospital systems and other medical partners with a common cause of reducing prematurity in Columbus. OBBO consists of Mount Carmel Health System, Nationwide Children's Hospital, Ohio Health, the Ohio State University Wexner Medical Center, Columbus Public Health, and our community's largest federally qualified health center, PrimaryOne Health. We know that prematurity is the #1 cause of infant mortality in our city. lack of prenatal care is one of the key drivers for prematurity. Only 67% of women in this community report seeing a doctor during the first 3 months of their pregnancy. If you focus on the women with the most barriers, the number decreases to only 52%. We must change those numbers. We know that the babies of mothers who do not get prenatal care are 3 times more likely to have a low birth weight and 5 times more likely to die than those born to mothers who do get prenatal care. Getting moms to be to the doctor early, within the first 3 months, and consistently during the pregnancy, enhances the chances of them delivering full-term babies and reduces our community's infant mortality rate. We believe we can reduce preterm births in Central Ohio through major strategies driven by OBO. Last month, the Ohio Better Births Outcome launched Step One. It's an information and referral service dedicated to alleviate some of the typical barriers that keep mothers from getting prenatal care as early in their pregnancy as they can. Step One is dedicated to connecting women in our community with access to timely, affordable, and convenient prenatal care. When a woman learns she's pregnant, help with finding a doctor is just a phone call or click away. Any woman who is pregnant or thinks she's pregnant can call 614-721-0009. I can almost feel a jingle with that in my head. Or they can visit the CelebrateOne website to get help with scheduling appointments. You may have heard the commercials on the radio or seen the benches in high-priority neighborhoods that help bring awareness about the importance of prenatal care and highlight the Step One information and referral service. Our goal is to increase the number of moms who deliver healthy, full-term babies. Prenatal care allows us to do just that, and Step One is a step in the right direction. As an OBGYN, I'm proud of the work of our collaboration to help address prematurity in our community and the launch of the information and referral service that helps more babies in our community and helps us to reach more families. Our community is fortunate to have hospitals and community-based clinics, as well as large networks of private physician doctors that can meet women's needs during their pregnancy. The medical community will continue to partner to reduce infant mortality in Columbus. Thank you, and at this time I'd like to welcome Jeff Klingler from the Central Ohio Hospital Council to share his remarks. Thank you.
Thank you, Phil. Good morning. So I'm president of the Central Ohio Hospital Council. The Hospital Council serves really as the forum for the 4 Franklin County hospital systems to come together and to collaborate to address healthcare issues that impact Central Ohio. So 3 of the strategies that were included in the Greater Columbus Infant Mortality Task Force report were assigned to the Hospital Council. And today I want to talk about the hospital's collective work around one of those strategies, and that being to eliminate the practice of scheduling deliveries before 39 weeks completed gestation without a medical reason. So for you non-clinicians in the room, such as myself, why are we doing this? I think the first sentence in the Columbus Dispatch story that appeared when we first announced this initiative sums it up well. A week or 2 more in the womb can mean the difference between taking your baby home after she's born and visiting her in the NICU. So the clinicians I have worked with over the past couple of years, Dr. Pat, Steve, Kelly, and his team, Dr. Art James, constantly tell me that a lot of development happens in those last few weeks. So throughout the discussions on this issue, our hospitals have pointed to several national studies that show that infants delivered at 37 weeks gestation had higher rates of respiratory failure and ventilator use compared to infants delivered at 39 weeks. Higher rates of respiratory distress syndrome and pneumonia are reported for infants delivered at 37 weeks compared to those born at 39 weeks, and mortality rates are significantly higher when babies are born at 37 and 38 weeks compared to 39 completed weeks. So to make sure that our hospitals are doing all that they can do to get a woman to deliver as close as possible to 39 weeks, in April of 2014, the CEOs of the 4 hospital systems adopted a set of community standards requiring all of the Franklin County birthing hospitals to develop and implement a hard stop policy that are designed to eliminate the practice of scheduling deliveries without a medical reason before 39 weeks completed gestation. The standards set a community goal of reducing the percentage of infants delivered, electively delivered prior to 39 weeks to 3% or less, which is actually more stringent than national guidelines. Those national guidelines actually call for more like 5%. So the council developed educational materials that we're using in all of our prenatal clinics to educate moms on the importance of going full term. And we also worked with the OBs throughout the community to educate them on the standards being implemented in all of our birthing hospitals. But we weren't done there. This is really a very important issue, and the hospitals feel very strongly that we need to stay on top of this. Continue to look at data to make sure that we're in compliance with our own standards. So the directors of the OB units of our various hospital systems meet quarterly, and they review the rates of early elective deliveries in each of the facilities to ensure compliance with the standards. Again, they set a very aggressive goal of no more than 3% of all deliveries being scheduled early. Happy to say that in 2014, the aggregate rate in our community was 1.8%, and in 2015, the rate was 1.0%. I think significantly better than other parts of the parts of the country. So I want to thank Leanne for inviting me to talk a little bit about this initiative, and I want to come back next year and talk about more work of the 4 hospital systems to work on this infant mortality issue in the community. Thank you. And so I get to introduce my friend, Teresa Long, the Commissioner of Columbus Public Health.
He almost forgot to introduce his friend on speed dial. So good morning and thank you. It's an incredible honor and privilege to be with you this morning. It's both inspiring and sobering. And Mayor, thank you. First Lady Kasich, thank you. President Pro Tem Tyson, and actually all of you, thank you so much for being here. We're here because we must. So with that, as you know, sleep-related infant deaths play a defining role in our infant mortality problem. In fact, we lose a baby every other week to unsafe sleep practices. That is 1 kindergarten class every year. As part of our collective efforts to reduce infant mortality, CelebrateOne charged Columbus Public Health, together with our partners, to reduce these preventable deaths. And I am happy to share with you this morning our progress. Last August, we launched a new infant safe sleep public awareness campaign. After extensive research, a series of focus groups, and community input, we successfully developed a multifaceted campaign including TV, radio, billboards, bench ads, very focused in our high priority areas, social media, and maybe some of you have even gotten the strategically targeted ads on your mobile devices that are playing near stores like Babies R Us. So let's take a look.
When putting a baby to sleep, it's important to follow the ABCs of safe sleep. Babies should be alone, on their backs, and in an empty crib. When we skip any of these steps, like letting them sleep in bed with us or with their favorite stuffed animal, we put our babies at risk. And on average, 1 baby dies every other week in our community due to these unsafe sleep practices. Protect your baby by following the ABCs of safe sleep. Learn more at CelebrateOne.info.
Sobering indeed, and yet moms told us that's what they needed to remember. A grassroots educational effort also complemented the public awareness campaign. We designed educational materials such as brochures and flyers, fact cards, and church fans, indeed, that put the ABCs of safe sleep directly in the hands of residents in our high priority neighborhoods. More than 14,000 educational pieces have been distributed in our community just since November. Additionally, we also launched the new Infant Safe Sleep Ambassador Program to reinforce the ABCs of safe sleep as a social norm in our community. Our team of experts at CPH, using national research and best practices, developed a free 2-hour training that teaches the basics of infant mortality, the social determinants of health, and safe sleep practices, with the idea that each one teaches 10. The ambassadors are empowered with the knowledge and the materials to educate family members, co-workers, church members, close friends, clients, even, of course, my next door neighbor and yours. Our plan is to multiply our message. The program kicked off in October, and since then it has been so popular that we've already had to expand it from every quarter to every month. So every monthly trainings are happening, and as First Lady Ross said, we will even come to you. By your being here, you really are a Safe Sleep ambassador. And again, we hope that you would consider which of your organizations might indeed be trained and become a part of that Safe Sleep ambassador team, just like First Lady Ross has done with her, both members and the ladies, the first ladies of all of our churches, but clearly Tridestone has stepped forward, so thank you for that. Again, it really is through this comprehensive effort around making the ABCs of safe sleep the behavioral norm that we're trying to address. So our 4 local hospital systems also have stepped up with us to make safe sleep a priority. Under the leadership of our hospital and our health system CEOs and the Central Ohio Hospital Council President and CEO Jeff Klingler, the hospitals are educating staff and new parents with the importance of a completely empty crib. Adhesive clings reading "Nothing but baby, bare crib is best" are now attached to each bassinet in the labor and delivery rooms and in the labor and delivery units, and NICUs to serve as a constant reminder that not even a nurse's syringe should belong in that crib. With this approach, the hospitals are educating parents and modeling best practices for families to follow at home. In addition to the empty crib, we are also making sure that families in need have a safe crib for their babies in the first place. Thanks to our Maternal and Child Health Division right at Columbus Public Health, we have distributed more than 1,000 Graco Pack and Plays just during 2015. So thanks to our community partners in making that happen. This program has continued and is continuing to grow this year in 2016, and we are now working together with, again, our partners on a community assessment to improve the effectiveness and the efficiency of our crib distribution program. Baby's first sleep at home must be a safe sleep. So while our work is far from over, we are off to a great start, and I am thrilled with our progress in CelebrateOne's first year. We know that with continued effort to reduce unsafe sleep and sleep-related infant deaths, we will make a significant dent in our community's infant mortality rate. Together with all of you, I am confident that we can and we will protect our babies. At the Community Connector Corps kickoff, we heard our mayor refer to you as his dream team. You are indeed our dream team. So thank you for all you do and all you're doing and all you will do to reduce infant mortality in our community. And now I would like to turn the program back over to Mayor Ginther, our team captain, who is here to share just a bit more, an important bit more, about our work and our ongoing commitment to high priority neighborhoods. Mayor Ginther.
So there are a lot of people who talk about Medicaid expansion and what it is and what it means. And without Mike and leadership President O'Grady and the great folks at JFS, this wouldn't have happened. But it wouldn't have been possible if a governor didn't have the courage to expand Medicaid. And so, First Lady Kasich, please tell the governor, thank you for having the courage to stand up for women and children in our state. Two other folks I want to acknowledge who have been great instigators in this battle and fight. Dr. Pat Gabby and Dr. Art James are both here and have been instrumental in this process, in this work, and politely and persistently grabbing me by the ear when necessary. Let's recognize Dr. Gabby and Dr. James for their great work. Dynamic duo. Thank you for all of our speakers sharing the great work we're doing to advance our mission of reducing infant mortality in Columbus and Franklin County. We've done in 2 short years is pretty impressive. And I am very, very proud of what we've done, but more importantly, what we will do in the lives of our youngest residents. We're making a difference, and we have yet so much more to do. We will continue to follow the roadmap laid out for us by the Greater Columbus Infant Mortality Task Force in addressing this issue. Our work is a combination of addressing problems, processes, and systems within our lead entity organizations, while at the same time connecting with our communities and asking for each community and neighborhood to help us develop solutions that meet their needs. As Erica highlighted earlier, at the grassroots level, we've started the work in 3 of our 8 high-priority neighborhoods. That work has led us to a better understanding of what families are facing, as well as their concerns, and we are engaging them to help drive towards solutions. Today, I'm pleased to announce that we are now ready to fully engage 2 additional neighborhoods to expand our outreach and education to more families across our city. Our next 2 high-priority neighborhoods where we will deepen our work are the Hilltop and Franklinton neighborhoods. We will begin a heavy focus and engage the community just as we have done in Linden and on the south side and the Near East Side. Our work in these neighborhoods for CelebrateOne will continue under the leadership of Columbus Department of Development Director Steve Shoney, Columbus Health Commissioner Dr. Long, and the CelebrateOne Director of Community Strategies, Erica Clark-Jones. We look forward to fully engaging the Hilltop and Franklinton in this work. And most important, we know this work will help to save more babies in our communities. It is now my honor to introduce another great leader of our work, our co-chair for CelebrateOne, and one of the great leaders through this entire process. Please welcome Mr. Michael Fiorelli.
Thank you, Mayor, and again, thank you for the vision to make this change in this community that we started a couple of years ago. It was you that got us focused. It was you that set these aggressive goals that we're on our way to achieving, and if not for that vision and that commitment, we wouldn't be here today. And I also appreciate and also want to thank certainly Commissioner O'Grady and First Lady and Governor Kasich. Thank you for your commitment, and Councilwoman Tyson and our leader, Leanne Eagle. Thank you so much. I'm so proud you sit and you look and you listen and you watch everybody in this room who are our partners and peers in this effort. We have enlisted such a large part of this community and all of you in the trenches doing what it takes to address what, yes, is a community crisis. And we also appreciate being here today at the Columbus Foundation, who is also a partner with us. Our work to reduce infant mortality is not only visionary and bold, but as you know, it's long-term. And reaching this goal clearly is possible. What we all know about this great city is that we put our minds together to address an issue, we come together and roll up our sleeves and we stay with it until that mission is accomplished. While we have quite a few miles to go in this marathon to reduce infant mortality, I am convinced that through the collaboration of all of you and the state and the county and the city and the community, we will finish this race stronger, healthier, with more of us and closer to achieving these goals. As I close, I'll leave you with this lasting thought. As we were planning this event, we thought how fitting it would be, this was a while ago actually, to share our progress and highlight some of our key accomplishments as we close in on Mother's Day. After all, that's what our work is all about, helping mothers and helping families deliver healthy babies and helping them get to celebrate their babies' first birthdays and to thrive beyond. So whether you're a mom or a dad or an aunt or an uncle or a grandparent, a sister, a brother, a cousin, a family friend, we are all in this as a collective. And together we will help more babies and more families in this community celebrate one. So thanks so much for being with us today. We appreciate all that you do and all that we're about to do. And that concludes our program. Thank you so much.